Hello everyone. In today's video, we will discuss the classification of periodontal pockets. It's an important concept for BDS students, especially useful for quick exam and viva revision. Periodontal pockets are pathologically deepened gingival sulcus. Their classification helps in diagnosis, prognosis, and treatment planning. Let us look at different types of pockets. Classification based on attachment loss. Gingival pocket, which is also known as pseudo pocket or false pocket, wherein there is no attachment loss. It is only gingival enlargement which is present, which will deepen the gingival sulcus. Whereas periodontal pocket is true pocket, wherein we have an attachment loss. Classification based on relationship to the crest of the alveolar bone. Supra-bony pockets are where the base of the pocket is coronal to the crest of the alveolar bone, whereas infra-bony pocket is where the base of the pocket lies apical to the crest of the alveolar bone. Based on the morphology, pockets can be simple, compound or complex. Simple pocket involves only one tooth surface. Compound pocket involves two or more surfaces. Complex pocket has tortuous path that may begin on one surface and spiral around the tooth to end up on another surface. Based on the disease activity, another classification can be made wherein pockets can be either active or inactive. Active pockets show ongoing inflammation, attachment loss and are more destructive, whereas inactive pockets are quiescent with no current progression of disease. Understanding the classification of periodontal pockets is very important because it helps in deciding the correct treatment plan, whether it is non-surgical or surgical therapy like flap surgery and regenerative procedures are required or not. To summarize, periodontal pockets can be classified based on relation to bone, morphology and disease activity, and also whether it is pseudo pocket or true pocket. This knowledge is essential for accurate diagnosis and management. Thank you for watching. For more exam focused periodontology concepts, don't forget to like, share and subscribe to the channel Learn Perio with Dr. Avinash. Also comment below which topic you would like me to cover next. Thanks again.